Addiction and Recovery Podcast. Understanding the terms that shape recovery.
Welcome to our podcast segment on addiction and behavioral health. Today, we delve into a complex emotional response that often accompanies addiction, shame. It's important to note that our discussion is for educational purposes only and should not be taken as medical or psychological advice. Many people experience moments when they feel a profound sense of embarrassment or guilt about their actions, especially concerning substance use. This feeling of shame can be particularly challenging, but it's crucial to understand that shame alone does not indicate how severe someone's addiction may be. In fact, its impact can vary greatly from person to person. You might be wondering how shame plays a role in addiction. It often manifests as a feeling of deep embarrassment, guilt, or humiliation related to one's behavior or circumstances. For individuals grappling with addiction, this might involve hiding their substance use or withdrawing from social situations. Shame can create a barrier, making it more difficult for someone to discuss their struggles openly. This isolation can have further implications affecting relationships and support systems. It's a common misunderstanding that feeling shame automatically signifies a severe addiction. However, shame can appear in varying degrees and does not serve as a direct measure of addiction's seriousness. Some individuals might experience addiction without significant feelings of shame. This highlights another misconception. Eliminating shame does not resolve the core issues of addiction. Shame is a symptom, not the root cause. Addressing it does not erase the underlying condition. In practical terms, this means that while shame can influence how an individual interacts with others and how willing they are to seek help, it is not the only indicator of addiction. Factors such as compulsion, continued use despite negative consequences, and withdrawal symptoms are equally relevant. Diagnostic criteria for addiction typically focus on behavioral patterns and their impact on daily life, rather than solely on emotional responses like shame. Understanding the role of shame in addiction matters for recovery communities and broader public health conversations. By recognizing that shame can be a part of the experience without defining the entirety of it, we can foster more compassionate discussions around addiction and recovery. For those interested in exploring careers in substance use disorder counseling or behavioral health, grasping concepts like this can help prepare you for the complexities of the field. Understanding the nuances of addiction and the emotional landscapes that accompany it can be invaluable. As we conclude, it's worth noting that educational institutions, such as InterCoast colleges, offer programs that delve into these important topics. If you're curious about paths in addiction counseling or behavioral health, consider exploring the resources available to you. Thank you for joining us today as we navigate these crucial issues together.